A long-acting vaginal ring for HIV prevention. The global burden of HIV/AIDS falls on women. In sub-Saharan Africa, nearly 60% of all new adult infections are among women. That's why women urgently need and deserve new choices for HIV prevention, so they can select the one that best suits their circumstances, which can change over the course of their lives. No one product is right for everyone. Existing prevention options include condoms and a daily oral pill known as PrEP. A new method, a monthly vaginal ring called the Depivarine ring, may be available soon. And in the future, a long-acting injectable and potentially a vaccine could also be made available. The monthly Depivarine ring could soon help fill an important gap with a long-acting product that a woman controls herself and could use discreetly to reduce HIV risk during vaginal sex. A woman would insert and replace the flexible silicone ring each month, set it and forget it. The ring sits inside the vagina, near the cervix, where it slowly releases an antiretroviral drug called Depivarine at the site of potential infection. Depivarine works by blocking HIV's ability to make copies of itself inside healthy cells. The ring must stay inserted to do its job. A woman would go about her daily activities as usual. There is no need to remove the ring during menstruation or sex, and it is rarely felt by either partner during sex. The ring was shown to reduce HIV risk by 35% in one large randomized clinical trial and by 27% in another. Encouragingly, later open-label studies suggested greater risk reduction by about half overall. No safety concerns have been seen in studies to date. Side effects were usually mild to moderate, such as urinary tract infection, vaginal discharge and itching. These resolved with no interruption in ring use. The monthly ring could be an important option for women who are either unable to use higher efficacy methods such as daily oral PrEP or who choose not to do so. Because the ring does not eliminate the risk of infection, it should be used with either a male or female condom. In 2020, the Depivarine ring received a positive scientific opinion from the European Medicines Agency, a milestone for women's health. It is an important step toward getting the ring approved and into the hands of women who want to use it.
Okay, so my name is Gladwell Muthoni. I'm a technical advisor with Elizabeth Glaser Pediatric AIDS Foundation for the prevention of mother-to-child transmission of HIV, which is now normally abbreviated as PMTCT, and also the reproductive, maternal and child health, also abbreviated as RMNCH. I work in the Central Region under program LVCT, the BT project, whereby we support HIV programming and looking at SRH and also TB within the Central Region, majorly 4 counties, Kiambu, Murang'a, Nyeri and Kirinyaga. So the prevention of mother-to-child transmission, this is basically whereby we support our women who are HIV positive to make sure that they get HIV negative children along the cascade of care, right from their antenatal care all the way to the time they are going through the delivery and also the breastfeeding or the postnatal period. We're also looking at those who are HIV negative just to make sure that they also don't get the HIV infection. So basically trying to make sure that they get the preventive measures. We have a combination of prevention measures to make sure that they also don't get HIV positive. So we are looking at both ends of the spectrum to make sure that we, at the end goal, is to make sure that this child does not get HIV infection. This is a national initiative that's in the entire country. Actually, we are working towards elimination of pediatric HIV by 2027. As endorsed by our president. Worldwide, globally, we are working at 2030. But with the president endorsed that as a country, we should be able to do this by 2027. So it's something that's ongoing for the entire country. We must say we've made great achievements and great gains. Over the years, when we started this in the early 2000s, our transmission rate was as high as 18% at that time. And currently we're at 8.7% as a country, and you're still moving. You realize that we've had counties that have already got into elimination. An example of Siaya and Migori County, and these are counties that are actually high burden counties when we look at the prevalence of HIV. So yes, we're on the right track and we're hoping to get to elimination, and our target is actually getting to less than 5% transmission rates. The workshop was actually about African workshop. It's an inaugural one, and we're looking at HIV and women. Reason being, if you look at the prevalence for HIV, the prevalence for women is always higher compared to men. Currently, as a country, our prevalence is at 3.7%. And if you look at women, women are at 5.3 compared to their male counterparts at 2.6%. So the transmissions are higher among women. And that's why we need to focus more on women, and also considering that they're the same people who carry pregnancies, and the transmissions to the children are basically high because of the women who carry these pregnancies. So that's why we need to get that attention to these women, just trying to focus on what can be done to make sure that we reduce the infection rates among the women, and also not reducing the infections among the children. So it's not like the men have been left out, but it's because the prevalence is higher amongst women, and that's why there's more attention towards them. I must say it was a very interesting workshop. Interesting because it covered so many aspects about a woman in general. So we looked at HIV prevention in itself. How do we make sure that women don't get HIV? Different combination prevention methods, such as the newest in town, if I may call that, that is the pre-exposure prophylaxis. That's coded as PrEP. The pre-exposure prophylaxis, this helps reduce the infections amongst women. Even if they engage with somebody who is HIV positive, then they get to make sure that they don't get the infections for themselves. So you also looked at care and treatment for this woman who is already HIV positive. What is it that we are offering her in terms of her treatment, in terms of care and support? How are we able to follow her through the cascade? Remember that HIV treatment is lifelong. So it's not a one-off. She has to take her treatment from the time she's diagnosed all the way until the end. We also looked at interesting things to do with other comorbidities. And here we are talking about cervical cancer, because one of the key things, like cervical cancer, is one of the killer diseases for women across board. And those who are HIV positive now, the prevalence is even higher for getting cervical cancer. So we looked at modes of screening and also treatment for these women. Far and beyond, we looked at things to do with mental health. It's become very important to discuss matters mental health, and especially after COVID, we realized that we have so many issues of mental health that have never been addressed before. So for the HIV positive woman, it's even higher. Because even as the conference looked at HIV, we're also looking at ending HIV-related stigma, because HIV comes with a lot of stigma in itself. So how are we able to end the stigma for this woman? So we also looked at that in terms of the NCDs, that's the non-communicable diseases. How do we integrate this woman to make sure that she gets comprehensive care when she comes to the health facility? And interestingly, we also discussed about things to do with like menopause. These are discussions that have never been had before. So what is it about a woman going through menopause? What are the pros and cons? What does she go through it? So we looked at it in terms of the priorities and also the challenges that come with this phase in her life. So we had quite a number of discussions. We also looked at abstracts. People have been writing researches. So what is it that people are discovering? And we had the new researchers, the new people who are writing researches, the students, and also we looked at people getting mentors from these conferences. It was a mix of a lot of expertise. So we had men and women who've been in the field for so long. We had experts, these are patients who've been taking their medication, both old and young women. We had even the adolescent girls giving their stories. So it was quite a very interactive section, whereby we got to learn quite a lot and looking at different strategies and even male involvement. How do we engage our men when it comes to the HIV management for these women? What is it that is expected of them? So there was quite a lot of discussions in those 2 days, just looking through at the entire cascade, the entire management of this HIV positive woman. In as much as it was an African conference, it was open for many people. People from all over the world actually came in to just have the discussions, because in as much as you're looking at Africa, there are many strategies that have been tried out there. And remember our guiding principle, we work normally through the WHO, the World World Health Organization. So whatever we're implementing is basically under the guidelines of WHO, which are practiced all over the world. So we got to learn from other countries as well. And if you looked at the researches, they would compare what was happening in the UK, what was happening in Asia, in Kenya, in Africa at large. And then what is it that would be able to compare and take home? So the strategies were not only what was happening in Kenya, but in Africa and the whole world as at large. So it was just about comparisons, looking at what strategies have worked. Because as we look at African women, there are things that we may say they're not working in Africa or in Kenya, but they've worked elsewhere in Asia. So what is it that we can take from Asia and you're able to practice it here in Kenya that would make a difference for our women? And like I said, we're looking at elimination by 2030. For our country, it's 2027. So we have a very short span of time, and just to make sure that we get to that elimination, or rather to end pediatric, and not just pediatric, but AIDS in general for the country. So when you're talking about prevalence, you're looking at, we're looking at the new infections. We're looking at the cases that we have. If you look at the new infections currently, even for the country, the numbers have really gone down from hundreds of thousands. From 2013, we had over 100,000 to the latest new infections at 22,000. If you look at that, from these numbers, most of these infections are coming from women and not from men. So we look at it in terms of statistically, if you have like the 22,000, who forms the majority of these? If you look at the number of people who are taking, or rather who are HIV positive in the country, we have about 1.4 million. From the 1.4 million, how many women form this population? It's about 890,000, almost 900,000. Then we have about 450 men, and the rest are children. So basically, we are talking about the huge numbers in terms of those who are HIV positive, those who are accessing treatment, and currently still those who are getting HIV positive. That is the new infections. So if you look at it in terms of women, why women? Basically, we look at it in terms of biological factors or biological makeup that exposes us, or rather predisposes us to getting the HIV infections. We're also looking at our culture, the way we are cultured as women. Most of the times we may not have a say in our society, and especially concerning sexual matters. Men take it up, or rather they have the privilege of deciding in terms of the sexual matters, either the initiation, the whole sexual process. You find that women tend to be quiet and men tend to take it up. And because of the way we are cultured, a woman not having a say, that means a man can decide whether to use prevention measures, just like condoms. They may decide not to use them. When you talk about PrEP, just taking the pre-exposure prophylaxis, a man may decide they're not going to take it, and the woman goes with it because the man tends to be the head of the house. He's the breadwinner. He calls the shots in that house. So in that case, then the women tend not to have their talk, or rather their say. And that's why we have such a conference, to bring women together and just to have the discussions around it. Like, what do you have to say about it? What is your take in it? So that it's not just dominated by men, but also women know that they need to take care of themselves in matters health, in matters HIV, and just cutting across for them to make sure that they are healthy, and then the quality of life is able to be improved. Remember, we also have a prevalence for men. They're also HIV positive men. And like I said, in as much as our national prevalence is at 3.7, the women may be higher at 5.3, but we still have men at 2.6%. By the end of the day, remember that HIV is still a sexually transmitted disease. And the women are having sex with these men. So that means we are all in it. It's not just the men, but also the women who are in it. And the men have, like I said, the way we are cultured, the men normally have the say. And we need to bring our men on board to just help our women to make sure that they don't get the HIV infections. If we get support from these men, just to make sure that our women are going, like from my program, when you talk about the prevention of mother-to-child transmission, if our men are able to support these women to get to the health facilities on time, to start their antenatal clinics early, beyond that, to start their HIV, to get the HIV test done, start their ARVs early if they're HIV positive. That means this woman would be able to access her care earlier on. And what about the men? We need also this man tested for HIV. If he's positive, he also needs to start taking his ART early, because we've seen things and concepts like U to U, this is undetectable is equals to untransmissible. And you're looking at it in terms of if you take your treatment well, then you're able to get to what we call viral suppression. When you're virally suppressed, your chances of transmission are reduced. They're very low. And like we said, women get these infections more, or rather their chances of getting the infections are higher, and they're getting them from men because of their biological makeup. So if our men are able to like suppress, they get to viral suppression. If they're able to use prevention measures, that means we'll be able to reduce the infections among women generally. And if you're able to reduce the infections among women, then you're looking at ending the HIV, or rather ending AIDS by the timelines that you're looking at 2030. And this is not just to the women, but also to the children who are affected as a result of the whole cascade, or rather, we look at the entire cycle. So yes, it's important to have the men on board, to have them in this discussion, and also to make sure that they're fully engaged. We need their voice in terms of taking care of the women, in terms of taking care of the children, in terms of them coming on board to help us in this elimination agenda. The woman might be at home, and actually we've had those cases, and that's why I'm talking about how we cultured as a society. We may have a good number of our women staying at home, and maybe she's a stay-at-home mom, or rather she just has her small farm that she tills at home. And as she does her tilling and everything, it's the man who is the breadwinner. It's the man who goes out. And we've seen with our society and looking at different men and having multiple sexual partners, then what prevention measures have they put in place to make sure that he doesn't get infected? Because he'll get infected out there and bring the disease back home to this woman who's been at home. And also looking at it on the flip, even if this woman is left at home, at times these men go and they go for a long period of time. So does this woman have a chance also of getting another partner in the village? Because it cuts across. We may not just say that it's the men who are bringing the infection. Even the women, they could be getting also partners at in the same village that you're thinking she's staying just at home like that. So it cuts across both having either the man or the woman getting the new HIV infection. But the thing is, how do we protect ourselves? If you get the infection, how do you protect yourself from infecting the other person? And if you've not gotten the infection, how do you make sure that you remain HIV negative? Yes, that's the most important thing, because we've gotten to a point of the epidemic control. Epidemic control is whereby we're not getting many new cases. Like I said, we've reduced from hundreds of thousands new infections to about 22,000, and they're still coming down. Some time back, UNAIDS gave us targets of the 90-90-90, whereby we are looking at making sure that the entire population, if it's a country, 90% of our people in the country, they need to know about their HIV status. Then those who are HIV positive, we should make sure that at least 90% of them are started on ART. Then 90% of them get to viral suppression. And you said when you get to viral suppression, then the chances of transmission reduce. Now we're able to get to those targets, and we've moved even higher. We are now at 95, 95, 95. We're hoping also to get to 98 and even 100%, just making sure that our entire population gets to know their HIV status. Then apart from knowing their HIV status, then they also started on treatment early, and we get to viral suppression. But our men, we tend to have them lagging behind. Generally, the health-seeking behaviors of men are a bit low compared to women. You and I will get sick today, and tomorrow we're seeking treatment in our health facilities. But our men take a little bit too long before they get to the health facilities to seek treatment. And this is one thing that cuts across even in terms of HIV, because it will take them a long time before they go to get their HIV tests done, for them to know that they're HIV positive, and so to get treatment. So it cuts across, and we need our men also on board to make sure that they get the treatment that they deserve, and just to make sure that they're also not able to transmit to these women. In as much as we look at this woman could be in the village, but yes, the man can bring the infection back home. Yes.
We're going to look.
So ART is antiretroviral therapy. Yes, the ARVs, yes, because it's treatment that we give them, and we said it's lifelong. So the 95, 95, and 95, just like I said about the 90-90, it's a cascade. And you're looking at making sure that 95% of our population gets to know their HIV status. So that you're looking at something we are calling status neutral. So status neutral is, if you're HIV negative, how do we make sure that you maintain your HIV negative status? If you're HIV positive, how do we make sure that you get your treatment and you live a quality life going beyond that? And we make sure that HIV is not a death sentence. You live many years. We've had people living over 30 years with HIV. So how do you live a quality life with HIV? Then the second 95 is for those who already are HIV positive, then how do we get them on treatment? And we want to make sure that at least 95% of these people get to start their treatment. And this is what we are calling their retroviral therapy, the ART, or better still, we call them the ARVs, the drugs themselves. If we start them on treatment, that means, and if they're able to adhere to their treatment, they're able to take their treatment well, it gets us to the third 95, and this is viral suppression. And as we look at viral suppression, we're also looking at retention into care and treatment. And if we get to now the viral suppression, that means then the chances of transmission, what I had said earlier, U is equals to U, undetectable is equals to untransmissible, then that means we're not going to be transmitting the infections to other people, because ART in itself becomes treatment, or it becomes a prevention measure, making sure that you're not transmitting the infection to other people. Yes, so that's the cascade of the 95, 95, 95.